Imagine for a second getting ready to buy a new car. How do you decide on the best choice? Maybe you're like me and you've read every article and review on Consumer Reports, Edmunds, Car and Driver, the expert analysis, the customer reviews. Maybe you ask your friends and family what they drive. Maybe you look at what cars are on the road. But I'll bet before you buy it, every single one of us wants to get behind the wheel. Now imagine you don't get to do any of that. There's no reviews or research. There's no safety ratings, no horsepower numbers, no legroom measurements or lists of features. But most importantly, there's no test drive. You don't get to feel the steering wheel in your hands as the car hugs the curves of the road. You don't sink into the seat when you accelerate. You don't get to hear the sound of the radio. You don't get a hint of that new car smell. Now imagine it's not just a car. Imagine this is how hospitals buy their equipment. Imagine this is how doctors and nurses and other healthcare workers get the tools they need to treat patients and save lives. Unfortunately, you don't have to imagine that. This is what happens. All too often, this is exactly what we see. Our staff using these tools are not making or even contributing to the decisions. Ventilators, IV pumps, anesthesia machines, even electronic health records are usually purchased with a framework of lowest cost, technically acceptable. There's nothing new. Like in my military days, healthcare workers find ways to improvise, adapt, and overcome. We saw this in the early days of COVID when healthcare workers made the best of what they could based on masks and other PPE in short supply. They pushed themselves to the very limit, some over the limit, doing more with less. We also saw the struggles of an antiquated supply chain. We have so many different and disjointed ways to buy, use, and set up equipment. During the pandemic, we had some facilities that wanted to send critical supplies like ventilators to places that needed them most. But some of them, they couldn't use them. They used different brands. They had different training protocols. And they had to say no thank you. It's kind of like if your car is in the shop and your neighbor says, hey, borrow my car. Then you realize you don't know how to drive a stick shift. We also saw healthcare staff dealing with the unknown. Not just the unknowns of the disease of COVID, but the unknowns of new processes and new spaces. We had COVID units in makeshift areas of the hospitals. We had to learn new ways to manage airways and run codes. We had to get staff up to speed on doing things they hadn't done in years. And we needed the frontline experts to help us advance the whole team of healthcare. And we needed a vehicle to make that happen. This is where simulation stepped in. At Simulorn, we built bridges among national offices, facility leaders, and frontline staff. We took the best knowledge and experience and shared that across the enterprise, the nation, even around the world. We facilitated virtual and real-world testing of novel procedures and workflows. Together, we found ways to empower the front line to keep veterans and staff safe. And we learned. We learned to move into a new world and find ways to meet the challenges of tomorrow today. We also started to question, can we do things better? Early in the pandemic, a colleague on a call, this is back when VA was just flexing to meet veterans' needs, changed a lot of things. And he said, if we go back to the way things used to be, we will have failed. So we started thinking, what if? What if we bring the tools and healthcare solutions of today and tomorrow into a simulated hospital for doctors and nurses to test drive? What if we defer to the expertise of healthcare workers to innovate the solutions our veterans need? What if healthcare simulation, the ultimate test drive, could validate technology before it reaches patients? And what if the largest healthcare system in the United States listened to their voices? Could that change veteran care? Could that change all of American healthcare? This is the idea of SimVet. Bringing equipment, devices, and software into our simulated hospital and producing a comprehensive analysis of how this impacts healthcare. An expert frontline team bringing the best resources to the best people to deliver the best care. Now, I believe this is possible. I believe that zero harm is a real goal. I believe that nothing should touch a veteran until it has been proven safe and effective through simulation. They deserve nothing less. I believe that one day we will stop saying, what if, and start saying, of course. Of course the experts are driving healthcare. Of course, safety is paramount. Of course, we wouldn't think of making major changes without test driving it first. If you got your phones, get them out. This is what we believe at SimLearn, one of those evil geniuses Devin talked about. If you believe this too, the SimVet team wants to hear from you. Honestly, this is the most exciting adventure any of us have ever been on, and we want to share that. So take out your phone, scan this QR code, check out our website, reach out to us. Come talk to me over the next few days here at IEX. Find out more about SimVet. Join us in reimagining veteran healthcare, in transforming the what-ifs of today into the of course of tomorrow. And let's make SimVet the ultimate test drive for the future of VA. Thank you.